My name is Sarah Hine, co-founder CEO for March Biosciences. Originally came to Texas to get my PhD training at Baylor College of Medicine, and really early through that training got involved in the startup ecosystem in Houston. That led me to working with Mercury Fund to launch a startup called Courier Therapeutics, which we sold to Velo Health, going to TMC Innovation to help launch the Accelerator for Cancer Therapeutics, which is a CPRIT-supported accelerator. And then through that accelerator, met Dr. Max Mokin and helped launch March Biosciences. Our lead asset is a CD5-directed autologous CAR T-cell therapy for T-cell lymphoma. It's an indication that's a smaller subset of the larger lymphoma leukemia population. But unlike most of those patients, there's really limited options available for patients in the relapsed refractory setting, and survival is unfortunately quite poor over a number of months. T-cell lymphoma is derived from your T-cells, so targeting it safely without completely destroying your normal immune system is significantly challenging across therapeutic classes. And so we're really aiming to develop a new kind of therapy to create a first and best-in-class drug with the hope that we can achieve durable long-term responses for these patients. The company is headquartered at Portal Innovation in Helix Park. Two of our lead sites, our first site activated was actually MD Anderson, Baylor College of Medicine, as well as via Methodist Hospital. But altogether, we have 10 sites active now. We have two more that we're bringing online in the next few months. And then we actually have a number of clinicians across the country that are queued who would like to join the trial sometime next year as we continue to advance into the later stages of this trial. I loved science, but I don't think academic science was ever my purest talent. What I really like doing is figuring out how to tackle hard problems and putting pieces together. And when I was in graduate school, I was always learning about translational biology. Like, that was sort of the buzzword and framing at the time. The most translational thing you can do is actually get the research out of the lab and into patients' hands, which is really through that process of commercialization. So that's what really drove me towards pursuing startups and early sort of stage product development more than sort of your traditional academic science. These immunotherapies in general, whether they're cell therapies or checkpoint inhibitors or cytokine drugs, they all have the ability to lead to these long-term durable remissions. And I've been working on cancer now for over 15 years and have really grown to appreciate that. At least for me, what gets me up in the morning is seeing a complete response and trying to push that forward into duration and seeing a patient who can potentially go back and resume their normal lives. And I think that's really the hope for all of what we do in cancer therapy. I'm Sarah Hine, co-founder and CEO for March Biosciences, and together with CPRIT, we're helping Texans conquer cancer.